Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Joining me tonight is Dr. Rubina Rawal, a subspecialist GP in skin cancer medicine. How are you,
Hello.
Rubina?
Good. How are you, Salia?
Good, thank you. And thank you for joining me tonight. I'm really excited.
I'm excited too.
Thank you. Rubina, before I pepper you with questions and ask you everything that I want to know, can you please tell us something about yourself?
I am a GP who's been in Australia and practicing for more than 25 years. So, came from Pakistan, where I was working as a gynecologist, then came to Australia, and here decided to do general practice because found it very interesting. And but I continue to do some women's health work in the general practice. Then after some years, developed interest in skin cancer medicine. So I did masters in that few years back. And so with that comes cosmetics as well. So I do a lot of cosmetic medicine as well. So basically do a lot of women's health, a lot of skin cancer medicine and cosmetic medicine. So that's me.
Very, very interesting. I hadn't heard of cosmetic medicine, but I always want to do cosmetic surgery because I think my face needs a lift, but it's too expensive, so I never do it.
Well, I don't think your face needs a lift, and also
Thank you.
the surgical facelifts are becoming less and less popular because there's so many other things available
Yes,
to give
yes,
you this lift with uh, you know fillers and
yes. And we are
anti-wrinkle
going to talk
injection.
about it in a bit. Yes,
Yeah, and
yes.
good skin care regime.
Oh, okay. Yes,
So
my daughter keeps telling me to do good skincare regime because I keep putting nariyal tail on my face, and she's like, no coconut oil.
that's for cooking, not for putting on your face.
She keeps telling me, don't put coconut oil. So she's got me all these fancy oils and everything. The days I remember, I put it at night, and then she'll call me and say, have you put it? And I'm like, yeah, yeah, I have. But anyway, so
Yeah,
tell us.
that's the in thing these days, coconut oil, but it does nothing, believe me.
Oh God, Rubina, you're just breaking my heart. I buy extra virgin coconut oil.
Oh, I don't mean to disappoint you. Tell us, has it made a difference?
I don't know. I don't care. When Samira comes, I'm like, yeah, yeah. Look at my face. My face is nothing. You can't see it's full of wrinkles. So,
No, I can't see any wrinkles, so it must be
well,
working.
maybe it is. I want it to work. As I told you, I get, extra virgin coconut oil. So, I don't know whether it's worked or not. But anyway, skin cancer. Let's talk about that. I know when we first came here, uh, living in India, I'd never worried about skin cancer. We were out in the sun. Nobody told us to wear sunscreen. 2 o'clock in the afternoon, we are walking to do our shopping or whatever else. And then you come here, and the first thing you are told is the sun is bad. So be careful of your skin. Hello,
Yeah.
Atik. There is a message from Atik from you. Salam Rubina Baji.
Welcome, Slamatik. Is Faiza there too?
I'm hoping he can listen, and but I don't know.
So let's see. You might have some questions, and you
Yes.
can type the questions. But talking about skin cancer and lack of awareness in India and also in Pakistan. So and also there's another emerging problem when young South Asian, people, they're growing in Australia, they are trying to do the same things as Aussies. They're exposing themselves even more to the sun. They're going to the beaches, and they are deliberately tanning themselves even more because nowadays there is this thing about brown skin. Uh,
Yes.
you know. awareness, people are saying that brown skin is beautiful, so they are going and tanning themselves even more, and so that is increasing their risk of skin cancer developing later on, because it may not happen instantly, but it may happen in 20 years, in 30 years. So a brown skin is not fully immune to skin cancer. We so it's only 2 or 3 times less than white skin, so it's still there. And the fact that we don't have awareness, the fact that we think we're immune and we become complacent,
Yeah.
and then we expose ourselves even more. One thing that is helpful in preventing this is telling Southeast Asians that sun is not just causing skin cancer, it is also causing wrinkling, and it is also causing pigmentation. That's when they try and best to use sunscreen and avoid the sun. Otherwise, no.
Okay. Hello, Samin.
Assalamu alaikum, Samin.
Samin is a gorgeous woman. She lets
She's
me
beautiful.
broadcast,
Yeah.
yes,
Yeah.
on her page. So I am broadcasting on her page too, along with mine. So thank you, Samin. Um, so it's surprising what you said, because we are. I don't know about tanning. I have never tanned, but I love the sun. I like going out in the sun. It has never bothered me, to be honest. But when I came here, the first thing the doctor said to me is to get my vitamin D checked. And he said, "You are low on vitamin D." And I said, "How is it even possible?" He's like, "People with our skin tones, we actually have huge vitamin D deficiency and we don't realize it. I mean,
Yeah.
all our lives, you come from a hot country, I come from a hot country, and we would think with the amount of sunlight that we have, vitamin D shouldn't be a problem, but apparently it is. I have to have vitamin D medication. I mean, not medication, but I have a tablet every night.
Yeah. So, particularly when they come to Australia, because they come from the equator and then they come to Australia, which is south of the equator. Um, and the brown skin takes a longer time to create vitamin D in the skin than a white skin. For example, a white person will only need 5 minutes of 20% skin exposed to the sun to make the same amount of vitamin D as a brown person would in an hour.
Wow.
So 20% exposed is like arms and legs. And so our people are not going to expose arms and legs. And there's so many Southeast Asians and migrants who are, fully covered. And so they become very deficient in vitamin D. And it has multiple consequences, not just osteoporosis, over time, but diseases like it influences the development of heart disease,
Wow.
diabetes, muscle weakness, and many other diseases. So, vitamin D is a hormone that drives other hormones. So, a deficiency of vitamin D is going to cause, multiple areas of ill health. So, it's very important to have adequate vitamin D. They say more than 50 um, in winter, and more than 70 for women who already have osteoporosis, should be more than 70. So that's how important vitamin D is.
So, Rubina, what is the difference between the skin cancer we South Asians have and white people have? Is there a difference?
There is, as we know, generally melanoma is uh, the most common in Australia. Like generally, the highest incidence of melanoma is found in Australia and then in
Yes.
New Zealand. And then coming to other skin cancers, uh, white people will get more basal cell cancers and then squamous cell cancers and then melanomas. And brown people will get more squamous cell cancers, and then basal cell cancers, and very low incidence of melanoma. But the problem is, when we get these skin cancers, we don't think it's a skin cancer because it's many of these are brown in color, and so
Oh, wow.
we let it go for a long time until it has advanced uh, quite a lot, and sometimes even metastasized. So especially melanoma. So melanoma in brown people is usually found in places you're not going to look at, like the soles of your feet. And
Whoa.
then, yeah, so soles of your feet or under the nails. The nails might be covered with nail polish. So, and then when you realize it's a melanoma, it's usually too late. So that's, yeah, so you won't get it on obvious places when you're a brown person. You'll get it in hidden places. So, importance of vigilance. And so, with the other cancers, the SCCs and the BCCs, it's not zero.
What is an SCC and BCC? Sorry,
So
I
BCC is the basal cell cancer, the commonest cancer in white population.
okay.
SCC is the number two common cancer. And just to give some information, skin cancer is the commonest cancer in Australia. So that's how important it is. And
More than breast cancer.
yes, more than breast cancer, it's the commonest cancer and the most expensive to the government as well. Skin cancer.
So how do we
So
keep safe?
yeah, so number one is not exposing ourselves to the sun, using sunscreen, and using hats, broad brimmed hats when we go out between 10 and 4, and dark glasses. Um, and then, you know, that's number one, the most important factor. And then examining ourselves every month, looking at our skin from top to bottom, not forgetting the soles of feet, not forgetting the spaces in between toes and fingers, not forgetting the nails, not forgetting the armpits, not forgetting the
Even there.
private part. Yeah, not forgetting inside the mouth as well, not forgetting inside the eyes as well and the ears. So that's how important it is.
So
So
how do
we
you
we sorry.
how do you check? So what if you were to get, you said check the eyes, check your, I can understand, your private parts and your body is all right. What signs for the eyes? Are there any signs that you have cancer? Is there a sign?
Yeah, look, the white of the eye might change and the colored part of your eye might look different. So when you know your body, you know if there's something different. Your vision may be affected. There may be some pain, some irritation. So and everyone over the age of 40 should get their doctor to check their skin once a year. And of course, if they've already had skin cancers, then it's more than once a year. So you can get yourself checked by a dermatologist or GPs who specialize in skin cancer medicine. So once a year over the age of 40 is very important.
Wow, is there any data, Rubina, about a percentage of South Asians get skin cancer, or
Like,
more women get cancer than men? Any data or?
yeah, so the thing about data is that the Western countries are collating all the data. Like you said in the beginning, that you were not aware of it when you were
No.
in India. So none of those countries are collecting any data except for countries like Japan and South Korea among Asian countries. And now China has also started. But the limited data that we have, like I said already, that the SCCs and the BCCs, they are only 2 or 3 times less in brown skin, not zero,
Yeah.
only 2 or 3 times less. So it's still there. So, um, yeah, so you'll easily find data from Western countries, but it'll be very hard to find data from Southeast Asian countries. We only have data um, from immigrants who are already here. So that's how I'm saying 2 or 3 times less
Yes.
than
Okay.
white skin.
Yeah. Hello, Jaya. I'm glad you joined in and watching us. Um, so Jaya is the president of Indian Care. You were
Hi,
asking me
Jay.
about Sandeep. So Jaya's question to you, Rubina, is: do you have any suggestions for treating vitiligo?
Yeah, so vitiligo is very, very difficult condition to treat. So it depends on the size and the location and the cause. So usually they are, so my job as a skin cancer medicine GP is not to treat vitiligo. I refer them on to dermatologists. But I can tell you that there's not much available except for camouflage, that means makeup. And there are some medicines that they take orally, but they have side effects and they're very expensive and they're under trial. But other than that, there is nothing much available for vitiligo.
So, I remember when we were growing up, if you have vitiligo, just even a spot here and a spot there, people talk because we talk about everything. And then a few years ago, I remember I was going through a friend's Facebook page, and she is an art of living instructor, and one of the women there, she's a model, and she's got vitiligo, and she was modeling. She is like, I had this as a child, and this is how I am. I'm not going to cover myself up with makeup. I will just be the way that and I know there are some big models, international ones, who now happily show off their vitiligo. I'm not saying good or bad or whatever, but I think people are getting more comfortable in their own skin.
Yeah, they should be too.
Yes, I mean, you
So
have no control over it.
you don't have much control over vitiligo. So we should learn to live with it and accept it. And it's not a contagious disease. You're not going to get it from someone. It's not a life-threatening disease. It's not going to do anything bad to the person or the person who's talking to someone with vitiligo. They are normal in every way. It's just that the melanin in the skin is not being produced for whatever reason, and it's not usually a dangerous reason.
Thank you. So let's talk women's health.
Sure.
uh, So one of the questions I asked you, um, there. Yes, Jaya, we can live with vitiligo. Thank you.
Of
Um,
course, yes.
one of the questions, I mean, I did ask you about women's health and cancer. Is cancer more prevalent amongst women than men among South Asians, or nothing like that? It is equal number, or do women get more skin cancer than men?
Um, Depends on the cancer. Of course, breast cancer is more common in women
Yes.
than men, but breast cancer is not the commonest cancer. And, we worry a lot about breast cancer, but women die more from heart disease than
Yes,
from
I
breast
know that.
cancer.
I know.
Yeah,
I actually had a cardiologist who came and spoke about it, that
yeah.
heart disease is more in women than, yes,
And
more
then there
women
are other
have.
things that affect women more than cancer, like osteoporosis, for example. So we should be, women need to be aware of multiple things, not just breast cancer. There's ovarian cancer, there's cervical cancer. Um, as far as cancer, comparing cancer, skin cancer in men and women, um, uh, no, I'm not aware of any statistics that talks about whether, I can tell
But
you this much, that the cancers which are related to sun exposure And if men are going out as laborers and farmers, then of course they will be more prone to uh, those skin cancers which are related to ultraviolet radiation, like uh, the squamous cell cancers and the basal cell cancers. So when I was in Pakistan, a medical student, I actually saw a farmer with a huge basal cell cancer on his cheek.
Oh my God.
Um, and so he had let it go for years and years
Oh,
before coming in for treatment. So we don't want that kind of thing happening in
wow.
Australia. We want to get to skin cancer when it is so small that you only can, you can remove it with a tiny incision and a tiny, scar is left, rather than a huge hole in the face or a
Yes.
whole ear gone, or a whole nose gone, which happens in countries where there's no awareness and they don't even know that they're dealing with skin cancer.
Wow.
So that's the important thing about skin cancer, that we need to get to it as soon as possible so that the deformity is not great.
Sure. Um, let's talk osteoporosis.
Yeah,
What do we
so
do to stop it? I know a lot of it is hereditary, isn't it? My mother had terrible, terrible arthritis, and from the time she was 36, she really suffered. She could not walk long distances, and because I saw mass suffering with arthritis, I ensured that I walk everywhere. Even in the shopping center, I'll park my car furthest and then walk. Even if it is like a 10-minute walk, I'll walk. And I try and walk every day.
yeah,
But
so osteoporosis is very, very common in women after menopause. It's extremely common, and so we need to screen women around menopause to see if they are going in that direction and start preventing osteoporosis. Um, can you hear me, Saliha?
sorry, Rubina, I don't know what happened to my screen.
That's
Uh,
all right.
it just went off. So, yes.
Yeah, so we were talking about osteoporosis. Yeah, so very common in postmenopausal women, women around menopause, and as people get older, men as well. So it's related to not having enough bone mass when they're
Yes.
growing up.
Yes.
It can even go back as when they were inside their mom's bellies and the mom didn't have enough nutrition. So it goes back long time, and then it's related to exercise, deficiency of vitamin D and calcium and other minerals, and things like smoking, alcohol, kidney disease, and so many other diseases like thyroid problems, which are very common in our community,
Yes.
and malnutrition, inflammatory bowel disease, which is pretty common in our community.
Wow.
Celiac disease is very common in our community.
Is it?
So
Wow.
yes, celiac is very common. So Like 1 in 200 people have celiac, and a lot of it goes undiagnosed. And so then later on in life, they find out they've got osteoporosis because the intestines are not absorbing the calcium from the food they're eating because they're inflamed.
Wow.
So then osteoporosis is important because it leads to disability, broken bones. If a person breaks their hip, which can happen, with a minor trauma, like they can just, uh, a minor fall or a slip and they break their hip, half of those people will die within 3 to 4 months. So breaking a hip is not just break a hip. It's a very serious thing. Half of the
Yes,
people will die. So,
I am just,
actually,
yeah, wow. So many things we don't know.
yeah. So, importance of having a GP who looks after you, thoroughly, and more so after you turn 40, 45. So there should be a GP who's looking after all your systems, paying attention to all your systems, not just that you go for a script, just go for a certificate. You need to spend time with your GP, chatting about all those issues.
So, does a bone density test help?
Um, yes, of course it does. It gives us some idea of what's happening, and it depends on many factors, the age of the person, the how much fat they have around the hip and everything, and then the data is collated, and you um, you observe and see the changes in the bone density. You see if the person has had any fractures, and depending on the certain levels of bone density and whether they've had fractures with the slightest amount of trauma, then they're treated. But at 70, Australia, like in Victoria, we can get a bone density that's free of cost. I think everyone should make use of that. But before that age, you will have to pay something like 120 to $50 to get
Yeah,
it.
because
And
I
it,
did it. Yes, yes. I think about $150.
yeah, it's not a big sum of money. It's a good investment in your health. It's once you if you find that you have osteopenia, which is one level um,
Osteoporosis.
below osteoporosis, then you can do something to reduce the risk of having frank osteoporosis, because it's not just a broken hip; it can be broken vertebrae, and then you have severe pain. You're bedridden for weeks, or you're on very strong painkillers, or you have fracture of your wrists. Riding a bike, you may just fall lightly and fracture a wrist or something, and then you're in a bandage for weeks and weeks. So, it's a very inconvenient and sometimes very dangerous disease to have. Shortens your height as well. So if you
Yes.
don't want, if you don't want to be short, don't
I'd
get
love to be
osteoporosis.
tall, except I wasn't born with it. My brother got all my mother's height. I got my father's height. So,
Yeah. So
um, we talked about the sun as we started chatting. Skin pigmentation, my biggest curse, I think, because oh my God, as I've aged, suddenly overnight, I see my face full of, freckles or all these black spots, my neck. And yes, at one point, I went to my GP and I said, I have all this, what I want to remove it. And she promptly sent me to this specialist who was like, yeah, absolutely, I'll do it for you. So, I'll do an inch every week or every 2 weeks, and I'll take $450 for each inch. And I'm like, okay, that's like $2,500. That's an international ticket. I'll go on holidays. So, I mean, my pigmentation is not important. My holiday is more
yeah.
important. But it is. Hello, Musaddiq. How are you?
Assalamu alaikum.
Um, so yes, so pigmentation is something I realize all of us go through, and it's terrible.
Yeah, so many causes of pigmentation that you were just talking about, the spots you were talking about can be caused by the sun,
Yeah.
and then the if you're just talking about you, it seems like the ones you were mentioning were just the ones caused by sun, like sunspots. And then Asians also have something called DPN, which are like little um, squishy, elastic, like black things that hang from around the eyes or in the neck area.
Oh, I know.
And
It's the skin tags.
they are like skin tags, but they're black in color and they're
Oh,
small.
okay.
So the normal skin tags are pink in color, but they look like skin tags, but they're black or brown in color. And they're very common in darker skin tones. And women are, if women get it, they're very conscious about it.
Of course, I would be too.
And it's very easy to remove with laser or radio frequency, or even with a surgical blade, but don't try it at home. And of course it's expensive, because if they're going to do it in a way that doesn't leave scars or doesn't leave infections, and they're trying to care that after removing it you're not worse off, then it's going to be expensive. Or those machines that are there to treat them, they are extremely expensive. So once you remove them, they come back as well after 5 or 6 years. They're not gone completely. And they are, as you get older, you get more and more of them. But the sunspots are flat and they are lighter than DPNs. And they can also be.
What's a DPN?
So it's a long name. It's dermatosis papillosa nigra. Well, it just means a papilloma that's black in color. And that's a genetic thing found in Asians and uh, Southeast Asians and Africans. It's hardly found in white
So,
skin Western.
so is there a cure?
No, the only thing you can do is remove them once they're there, and you can prevent them by having good skin regime, a skin regime that exfoliates your skin on regular basis, gently. So not like the rough exfoliation, because our skin, Southeast Asian and dark toned skin, cannot tolerate too much of irritation, because that creates another form of pigmentation. Because then that wakes up the melanin producing cells, and the cells, they produce more melanin, which is the dark pigment under our skin. So we have to be as gentle as possible with our skins. And then there are other brown spots which are called seborrheic keratosis. They are like rough patches, usually found around the eyes
Yes,
and
yes,
on the sides of the face. And they
yes.
just keep getting bigger and bigger and bigger.
That's right.
And
Yes.
they are very common after the age of 45. And so they are also very common in Southeast Asians and Africans. And prevention is also good skincare with exfoliators like the fruit acid.
And not coconut oil.
Oh yeah, no, coconut oil doesn't have any exfoliant in it. So we need fruit acids, we need retinol, we need vitamin C, we need vitamin E, and so we need to have skincare which have all those A, C, and E, all those vitamins in it, and also vitamin D that we eat or we create in the skin. That's important as well.
Thank you.
You're welcome. And then there's another form of pigmentation. It's called melasma.
Okay, sorry.
Yes.
Ahmad, walaikum salam. So there is a message for you, Rubina, from Ahmad Karar.
Hi, Ahmed. Assalamu alaikum.
Sorry, I
Ye-
interrupted you there, Rubina.
Yeah, another form of pigmentation called melasma is very common in Southeast Asians, and that's usually found on the forehead, cheeks, on top of the lips, and nose. And that's also related to hormones, sun exposure, some medications, and people who have this, they try to go and have lasers done. They do all sorts of things, never gets better. And that's also when it happens in pregnant women, it's called cloasma, and because of the hormones of pregnancy. So to control that as well, we need to have good skincare, because you can't go and have lasers and all those expensive things, thousands of dollars regularly, because you need something to that can be done regularly to keep it under control. Otherwise, after one laser, few months, it'll be back again. So you'll be spending thousands of dollars every month, and it'll keep coming back. So you need to have good skin regime for that. The particular skin products to keep that under control, not 100%, but like they have about 80% effect on it.
And so that effect is also for people, for men and women over 45?
Yeah, whoever has melasma, but it has to be first diagnosed
Yes,
by
a
a
GP.
doctor who's got interest in skin. Not
Yes.
all GPs do. So you either go to a dermatologist or a GP who's got interest in skin, and they diagnose what these conditions are and what their treatment would be. So the importance of going to a doctor to get a proper diagnosis, because there could be a hidden skin cancer which a beautician may remove. But
Yes.
nowadays, beauticians are educated enough to send the clients to doctors if they think that this does not look like an innocent pigmented thing that they can remove in their beauty parlor.
Yes.
So it needs to be assessed by a doctor before they do something about it.
Okay. Thank you.
Welcome.
Talking beautician and laser clinics, we come to the subject of the day, Botox. It is
Yes.
so accessible. It has become so cheap. So let's talk derma fillers. Let's talk the advantages, disadvantages, complications.
Yeah, so fillers are something, it's a hyaluronic acid, which is like it's like a gel that is injected under your skin to plump up the areas which become deficient as we age. Um, it's also used by younger people to build areas that may be deficient or they want enhanced, like the lips or the cheeks. So it's not there are people that should not have it, and so it's not like just going into an office and getting it done and that's it. So you have to be a suitable person for it, and there are complications to worry about as well. So if you go to the right person, they'll have the training to inject it safely. If you go to just the around the corner
Yes.
person who's not very experienced, I won't say who, like these pop-up
Yep.
laser
Yep.
clinics, and they're at home businesses where they're putting fillers.
Really?
Yeah, yeah, people are doing it in at their homes as well. They're throwing parties to give people fillers and anti-wrinkle injections. So in a home environment, you don't have facilities to treat if a complication occurs. In the fillers, for example, they can block arteries in your eyes. People can go blind. You need to have very proper knowledge of anatomy. May I interrupt to say salam to somebody who just came in?
Yes, of
Mamta
course.
Jamil. Hi,
Hello, Mom.
Mamta. Yeah, so the complication of putting fillers, if it's done by wrong hands or not done properly, even by the most experienced person, it can block arteries in your eyes. People can go blind. So, so it's not a joke. A filler is not a joke. It should be taken very, very seriously. But the anti-wrinkle injections, which are more commonly used than the fillers, they are safer. But they if they have any complications, they are very temporary, and so they're generally pretty safe. But the problem with going to backyard practitioners is that they will cause side effects like droopy eyelids. You know, they would put some anti-wrinkle injections in your forehead, and your eyelid may droop. So, yeah.
I just had a cough coming.
You okay now?
Sorry, Rubina.
That's okay.
I'm listening.
Yeah, and they're very expensive. Like the fillers are very expensive. So yeah, so it's like if you want your cheeks done, it's something like $1,400.
How many $100?
1,400.
Oh my God.
Yeah.
And people
Oh,
do.
one thing I didn't mention. Australia is the country in the whole world that is number one in having cosmetic injectables. So we Australians are the most who use these cosmetic procedures. And then after us is, I think, South Korea, and then other countries like USA and Canada, but Australians. So we have a a lot of people using these.
This is scary. I mean, how expensive are these? I know. Sorry. I know there are young girls who plump up their lips. I've seen them at work. My girls' friends. So, but this is
Yeah.
so.
So now,
No, sorry, Rubina.
yeah, younger and younger people are coming to have it done. So a good doctor would discourage very young people. So they because I mean the 16, 17-year olds are coming in asking
What?
for lip fillers now,
My
and
God.
so yeah, so it's not the right thing. I in my practice I don't encourage very young people to have these procedures done, and in my practice I only do natural looking results. I mean, you will see people walking in the streets with huge lips, huge cheeks with the eyes like slits. That's overdone fillers, and they're probably done by the wrong practitioners or the backyard practitioners who don't know the actual anatomy of where they should be injecting. And these people are strutting around showing off. Look, I've got all this money, I've got it in my face. So 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 that's how it is.
Last topic for the day: cosmetic surgery.
Depends on what you call cosmetic surgery. So, like removing those spots that you were talking about, that also comes in cosmetic surgery. Look, those DPNs and SEBKs and sunspots, that all comes in cosmetic surgery. And then there's facelifts and uh, rhinoplasty.
What's
That's
rhino?
not Rhinoplasty is when people have their noses shaped. Um, so that's not done by me.
Okay.
Sorry, I didn't read that question. So Ajmal is asking, what
Ajam. Hello,
what
Ajam.
is? Oh, sorry, Ajam is asking, what is your advice to young women who are adamant on getting fillers due to trends they see on social media, and what are the long-term implications of these fillers? Yeah, in my practice, I discourage young women. So I spend time educating them about the complications. Like I mentioned before, rarely they can block the arteries. You can go blind, although it's very rare. Not just that, if sometimes um, these young ladies want their noses reshaped, it can block arteries in the tips of the noses, and the tip of the nose can fall off. And then there are some who want to get rid of these lines here, called nasolabial folds, and you put fillers in there. That can also block the artery of the tip of the nose. So they are going around for weeks and weeks with a black tip of nose that sometimes has to be treated with a skin graft. So instead of getting a good result, they're getting bad results. So you educate them. You tell them it's not that simple. If you really have a huge problem that needs to be fixed, like there are some people who have very asymmetrical lips, one lip may be bigger than the other, you and they may be getting bullied at work or school, or even
That's a
then,
genuine problem. Yes, that's a genuine issue.
yeah, but even then, no less than 18 years. And even then, it's not about shopping to see who's going to charge the least. It's about going to the best practitioner who has the most experience in doing those things, and they have a safety record as well, going to them. So I believe in correcting problems, but I don't believe in doing things unnecessarily.
Hello, Sahar. Walaikum salam. This is for Rubina. Salam, doctor.
Assalamu alaikum, Sahar.
People act. I'm just in shock, honestly. People actually want to get rid of these lines, and anyway. So let's hear about the cosmetic surgery part of it. So you talked about the neck when I had a fit of coughing, pigmentation. What is the right cosmetic surgery? And I know what is not the right cosmetic surgery. And because beauty is so skin deep, I mean, after a while, it really doesn't matter. After the first flush of youth, it is what you do and who you are as a person. I feel that matters the most. But
Yeah, of
maybe I'm
course.
old fashioned.
Yeah, of course, but you need to age gracefully. You need to look presentable. You need to have some kind of skincare where you end up using the least amount of makeup so that your skin is being replenished, the top layer of skin is being rebuilt, um, so that it's glowing and there are no dark spots here and there and all those other things developing, sunspots developing. So that can all be done with a good skin regime. And you need to also talk to you know, a dermatologist or a doctor who does skin medicine to discuss what is the right skin regime for you.
Thank you,
So,
Mamta.
Mamta, that's your favorite topic. What would you like to know about it?
Please don't use coconut oil. That much I can tell you. Coconut oil does not work. If my daughter's listening, she'll call me up to say, "I told you so, mom." But I don't know if she's listening.
It's a true story. There was a lady who put coconut oil on her face, and then she went out in the sun, and she thought that was going to fix her eczema, right? And then the next day she came to know, because her skin was all dark and black and patchy from putting coconut oil and going in the sun. She burnt her skin. So we are very, South Asians are very prone to skin getting pigmented. If we go out in the sun, or if we inflame our skin, the sun, the radiation in the skin, the ultraviolet radiation in the sun, sorry, that inflames the skin, and that's why the skin becomes dark, because the melanin gets overproduced by any injury or inflammation.
My God. So yes,
So
no
if you're
coconut
if you've got coconut oil on your skin and you're
oil. I
going
don't go out with
and
coconut oil, Rubina.
and you're going cooking, Even the heat from the stove will make your skin darker. Did you know
Oh,
that?
oh God, I've done that. Yeah, like me, Mamta has done it a million times. There you go.
Yeah, yeah. So, or have you? Yeah, so don't put oil on your face and go do some big batch of cooking because your skin will go dark.
There you go, Mamta. I thought I would have youthful skin. It didn't happen. Yes, really, really. So from tonight, I will stop, and I think it's time you stop too, because coconut
Yeah.
oil does not help. Oh my
Yeah,
God.
we do so many things that we don't know about that's causing the, skin getting darker and pigmented and patchy. So then, it's hormones as well. So people who are on the, HRT, or who are using the pill, or people who are pregnant, they're more prone to pigmentation. And then people who have diabetes, people who are overweight, they are more prone to pigmentation. So all those metabolic diseases make you more prone to pigmentation. So keeping our weight down is very important to control pigmentation as well. So there's no offense to anyone who's overweight, but being overweight causes all these problems, starting from the skin and going deeper down.
Thank you. Yes, Mamta, please use it on your head only. Don't use it anywhere.
Good
This
advice.
is scary. This is so scary, but yes, I hope my daughter's not listening. She won't say I told you. Thank you, Mamta. See, that gave us a good reason for laughter after all my coughing fit that I suddenly had.
I I have to vanish to get the wire because my battery is going down. Give me a
Okay.
second, please.
No, don't worry. It okay. So Mamta and anyone like me who thinks coconut oil is the answer to everything, it doesn't work. We've just busted a myth. So all these new age theories of coconut oil being the new
Thanks for
super
that.
oil, no problem. I was just busting a myth about coconut oil. So yes, no coconut oil, vitamin C, D, E, whatever, I think anyway. So
Yeah, all these vitamin A, B, C, D, E, and F, they're all important for the skin.
yeah,
So, vitamin A you can get in skin products, the retinol. Vitamin B you can get in the food, and also B3 capsules or tablets you can get from pharmacy. It helps to repair your skin faster. Vitamin C you can get in skin products. Vitamin D you can eat. Um, Vitamin E you can get in fruit and vegetables, and vitamin F is uh, in fatty acids. So certain fatty acids are good for us.
hello Anand, I'm so glad you've logged in.
Hi, Anand.
Um Mamta, you and I know now what not to do. So, thank you, Rubina. It has been such a pleasure talking to you. I have got
You're
to go and
most
buy all those vitamin E tablets now for my face. I do use a very good oil, but I won't. I'll text you on what the oil is. It's been really good for me. So no coconut oil. Yes.
It's been a pleasure chatting with you, Saleh, and all those interesting questions from the audience.
Yes.
It was fun talking to everyone and discussing everything. Thank you for
Thank
having me.
Thank you for coming. Good night, everyone. I hope you enjoyed the show like I did. And apologies for the technical glitch and my coughing